you?
Hey Trey, how are you?
I'm well. I'm well. This is really is great to have you here because I'd love to know about your history. You know, what got you positioned to now take on this role as director for such an important job here when it comes to public health, Seattle King County.
Oh no, that's a great question. So I actually moved here from St. Louis about 5.5 months ago, and I did that deliberately because in the world of public health, Seattle King County is rated amongst the top three public health departments in the country. And that is a testament to the quality of the workforce that the people of King County have at their disposal. Whenever we sit around the table of public health to discuss any issues, we generally begin by asking ourselves one question: what would Seattle King County, LA County, or New York City do about the issue? And then we work backwards to scale the solution to our resources. So from that point of view, you know, this is an amazing opportunity, and I am absolutely delighted to be here.
Well, thank you for sharing that. As someone who resides in King County, I get to experience, I think that, and oftentimes a lot of citizens don't realize the resources we have at our disposal. And sometimes it can go overlooked or unappreciated. But the truth of the matter is, when you go to another state and you are dealing without those resources, you really feel the brunt of that. So you were dealing with public health already outside of Seattle before you got here?
Yes, so I've been in the public health field for nearly 30 years. I am an infectious disease and physician and medical epidemiologist, and I've lived and worked in many different parts of the world, um, from Australia, Pakistan, Vietnam, South Africa, and for the last 22 years, the United States. And I've had the pleasure of working in several different states and cities, including the private sector. I would have to say that working at the local level for a city or county department is the best possible way to experience the immense personal gratification and satisfaction you get from helping people every single day, because you don't have the luxury of hiding away in your office in a state capital or the federal capital. You are face to face with the very people whose health and well-being you're responsible for.
Yeah, that's important. And I can only imagine that it's a great driving factor for you to really actualize the goals now that, you see yourself championing in your role with public health. Tell us a bit about what those goals are so that folks can understand a lot of the work you all are doing there.
Absolutely. So before I dive into the details, let me just, invite everybody to go back to December 2019 and what the shape of the world was then. What is it that we were worried about in terms of public health issues? Obesity, cardiovascular disease, diabetes, cancer prevention, suicides, mental health, etc. Right? These were the major issues. Obviously, homelessness and drug dependence were still an issue back then. When the COVID pandemic hit these shores, and Seattle King County was amongst the very first agencies to respond, in fact, the rest of the world and pretty much the rest of the country was watching to see what Seattle King County did in response. And so our amazing health officer, Dr. Jeff Duchin, and the colleagues at Public Health Seattle and King County led the fight against COVID in those early days, uncertain days, before the vaccines arrived and we knew a little bit more about the disease. But during that 3-year period, and it's been amazing, it's been a 3-year battle. The public health workforce is exhausted. We have been burnt out. We have been in the trenches fighting this battle on all fronts 24/7. We had to set aside everything else that we did, all the things that I've just listed. Basically, it was an all hands on deck kind of response. So everybody stopped doing what they were, dived into pandemic response, emergency response, equipping our community with the information and the tools and the clinical care that they needed to save themselves and protect their loved ones. We've been doing that for 3 years nonstop. We've lost people through attrition and burnout. The pipeline for public health professionals coming into government service is now slowing down to a trickle. We don't see people signing up in droves, and that's because they've seen what's happened to those of us that were in the trenches. Throughout the country, during the course of the last 3 years, over 500 public health department directors have either been forced out of their jobs, forced into retirement, or harassed to the point that they have simply quit and left. I'm one of them. I moved here from St. Louis precisely because of that, because I stood up for masks, because I stood up for the basic restrictions we needed in place to stop the control of a potentially deadly respiratory disease in some of the most vulnerable and underserved communities um, in our country. And the story is the same in all metro areas. Minority communities got hit the hardest. They are the most underserved. They are marginalized. They are ignored and have been for many, many, many decades. And this was just another complication on top of that. So, to cut a long story short, recovering our workforce from all that exhaustion is priority A1. Getting people to take a deep breath and figure out once again why that fire burns in their belly and they show up for work every day wanting to help people. Why don't they just leave for the private sector to make more money? What is it that drives them towards public service? Rediscovering that fire is priority A1.
I gotta tell you, I'm not often moved, um, but that was moving, and I'll say it because honestly, for me, as somebody who has dedicated so much of my life force and energy to serving community, you know, I realize as a Black woman, as a mother of two sons who are going to be men in this country, that oftentimes Black men are the number one target in this country. I'm always saying my sons keep me going. There's something that drives me as a Black person. I don't have a choice to do this work. So I really appreciate you coming from that perspective. And it's going to take that kind of intentionality for all of the staff, all of the employees in public service and public health in particular, to really feel that, right? Because
Absolutely.
they do have to understand that them being in their role is what's going to help us get over all of this. And honestly, it's been exhaustive for all of us, right? And so much more so for those who have been called upon to be the leading experts, to be the ones that we talk to be the ones that we go to, right? Omari and I talked a lot about how Seattle in particular showed up when it came to COVID-19 response. And we realized then that we had all of these resources, testing sites everywhere. There was, when vaccines came out, they were everywhere. It was just accessible. And when I was talking to people across the country, they're like, we're not experiencing. And I'm like, what?
Right.
How is that not? We have them on every corner. We have all of these resources have opened up to us for those who could not pay. There was all these free resources. There was resources in terms of money to help you pay for things that you needed on everyday level. So I really experienced that, particularly when it came to the COVID-19 response. And you're right, we're still in this. A lot of folks are like, well, during the pandemic, I'm like, it's still here, right? People are still dealing with COVID-19. People are still dying. We have seen that, okay, we learned more about the vaccines over time. There's a lot of information that's coming out. So I appreciate you taking that kind of approach. And I know the employees who stick it out will also really be able to really feel that and experience that.
Absolutely.
That sounds like that's going to be a major work for you. When we think about some of the other things, as you said, that have had to take a back seat, you mentioned, addiction. You mentioned that, but it's true. These fentanyl cases are continuing to rise. And it is such a public health crisis, such an issue. We've been talking to Brad Feingood about this. We've been on this for quite some time. And unfortunately, the numbers are not getting better here. What do you say to that and to some of those other things that had to kind of take a back seat during during this pandemic. How do you juggle all of it? And tell me specifically what y'all are doing about these fentanyl cases.
Absolutely. Thank you, Trey. That is an awesome question, because that is something that's keeping us up at night. Even as we continue to deal with this stage of the pandemic, the fact is that the fentanyl crisis is not even so much a crisis anymore, because it's fashionable to label everything a crisis, right? I describe it as a slowly unfolding catastrophe. The bodies are literally piling up. Ask any medical examiner's office across this country, any metro area. I challenge you, they will say the same thing. Nearly 60% of the deaths being reported to them for investigation are related to opioids and fentanyl overdoses. It is ridiculously cheap. It is flooding our streets. It is killing people in the prime of their lives. It is driving up our mortality stats to a point where the numbers are simply astronomical. Every year we seem to be breaking a new record. And I don't see an easy end or an improvement in the near future. I'm going to be very honest with you. I have said this to everyone who has asked. In order to stop people from dying, we need a massive investment of money from the federal government, because neither the state government nor the county or city government level at any point in the country have the same resources to make a difference. I'll give you an example. Back in 1989 or 1990, HIV/AIDS was considered a death sentence. What changed? The arrival of treatment, but more importantly, the Ryan White Care Act, which allowed the federal government to pour billions of dollars every year into every state to enable them to set up prevention, long-term treatment, care and support programs, and housing opportunities for people living with HIV/AIDS or those at risk for HIV/AIDS. Today, HIV/AIDS is no longer a death sentence. People live their lives. Although it is an ongoing pandemic in many ways across the world, it's the pandemic that the world seems to have forgotten. The fact is that in the United States, we are so much better because of that investment. That's the kind of investment it will take to make a difference in the opioid crisis, in the fentanyl crisis. Short of that, we're going to be chasing shadows, it seems, specifically at the local level, even with our limited resources. We are pouring our efforts into data collection and surveillance to figure out what is going on, into treatment and linkage to care and support programs wherever possible. And by the way, inpatient treatment programs are expensive and they're not really available. If you and I or one of our loved ones had to seek inpatient treatment, the opportunities would be difficult to find, even if we could afford them. And the private sector is prohibitively expensive. We're trying to make treatment available as much as possible, even as we try to help people who suffer from substance use disorder to try and protect themselves against the harm that the use of those drugs might cause, like using fentanyl test strips to figure out what is in their supply. If there is fentanyl, don't use it. You're at risk of an overdose. Use clean needles so that you don't suffer from bloodborne pathogen infections like HIV, hepatitis C, etc. And then an ongoing series of support mechanisms to make sure that we link people to the services they need. The homeless, for example, those without housing are particularly at risk. In fact, the number of fentanyl deaths in the homeless population has skyrocketed across the country. King County is no exception. All signs point, as I said, towards a catastrophe. Back to your point about homelessness. A housing first approach is what King County is doing, and our colleagues at the Department of Community and Human Services work hand in glove with us to do an amazing job. And Mark Dones and Birkland and their crew at the KCRHA are simply amazing. Full marks to them. Stable housing without any preconditions, including all the wraparound services necessary to get people the treatment, the long term care, and support that they need, is the way forward. Housing is health. Housing is healthcare. Housing is public health in practice. All those efforts are ongoing. But Trey, the scale of the problem is so huge that the resources we have are nowhere near enough to put a dent in the problem. And I'm being deliberately cautious in stating that. I'm understating it.
I gotta tell you, this is for me the enormity of what you're describing. I want us all to really hear Faisal here. This is not just for those who are dealing with addiction issues right now. I mean, we are talking about it being infused into so many different products that we do have to be careful. I appreciate what you shared there in terms of the strips, the testing strips, and really being able to identify how fentanyl is being infused into other care that people are thinking, oh, I need this. We've talked about opioid addiction, the growth of it. Um, if this level of intentionality was put into communities in the 80s when we saw this enormous crack addiction spike, there's so much that could have been prevented
Oh, yes.
then. And so I think already as a nation, and you are right in terms of it needing to come from a federal perspective, because as a nation, if we're all dealing with the same issue, now it's on us as a country to address it. And I find oftentimes for me, as someone who is witnessing it all, I say, why is that not happening more often? Really appreciated your example of the HIV virus, which, as we know, it came through and the federal government did something major about it. Um, it's going to take that. And I 100% agree with you. Clearly, your expertise is necessary at public health, and your passion for this work is going to be something that I'm sure will be a guiding light for those who are following you in this year to come as you settle into this role. Just tell us what you're really hoping that the folks that are working alongside you are really going to gain from them giving of themselves, because a lot of the issues that you all are facing are enormous in a way that maybe the response of it, what you all do, may not be felt widespread.
Right.
How do you ensure that, what you're sharing with me, because I'm feeling your passion right here, right now, how do you ensure that others really experience that so that they will continue in this much needed work?
I think about that quite often. Part of my leadership responsibility is to constantly energize our own workforce. And we do that by talking to each other, by sharing success stories, by celebrating the work that we do, by recognizing the differences we're making in the lives of people, by improving their health status indicators. At the same time, I'm constantly cognizant of the fact that this has always been a marathon, it's not a sprint. And so, the journey towards good health, optimal health, and well being is a continuum. There are constant threats, old and new, that keep emerging, COVID being the most recent. But we are in the age of the pandemic. Can we predict what will happen in the next influenza season? No. Should we prepare for it now? Yes. Were we prepared adequately for COVID? Absolutely not. The United States' response to COVID will have a chapter dedicated to it in textbooks written 50 years from now. And the title of that will be How Not to Respond to COVID, How Not to Respond to a Pandemic. Despite what we've been able to accomplish over the last 3 years, we wasted a lot of time. And as a result, other countries count their dead in the tens of thousands. We count our dead in the millions. 1,090,000 men, women, and children dead and counting. That is criminally shameful for a country that had all the resources in the world. more than any other countries, more than any other bloc put together, and we still ended up with 1 million+ dead. The other thing that I try to do deliberately is to get people in my own team, in our own workforce, to take a deep breath and dial out every now and then, because compassion fatigue, work fatigue, overload is real, burnout is real. It is causing people to retire early, to seek employment elsewhere, and I do not begrudge them that. Um, we live and breathe in the same space that everybody else does. The one thing that I would say to all the residents of King County is it is an absolute honor and privilege, a humbling experience, in fact, to live and work in a place where people truly value their own health and the health of their community. And so when a public health issue arises, or a health issue arises, or an environmental health issue arises, people are very passionate about it and proactive about it in terms of supporting the powers that be, in terms of funding the efforts necessary to address those problems. I assure you, my friends, that is not true in all parts of this great country. I've experienced that, and it is not pretty. And the end result is, as I said, tens of thousands dead compared to what we did in King County. And so take a bow. Thank you so much. We really appreciate your support.
Wow. Oh, Faisal, of course, we could talk for a very long time. We may have to do a special. We may have to
Anytime.
make that happen. For now, though, make sure folks know how to connect with public health. How do they stay engaged in all the issues you all are working on? You can look right there and let folks know how to tap in.
Absolutely. So if you want to find out how to help people with substance use disorder, opioid addiction, fentanyl addiction, or other addictions, warecoveryhelpline.org. I'll repeat that, warecoveryhelpline.org. If you want to get in touch with Public Health Seattle and King County to learn more about our work, share your thoughts and opinions, or follow us on social media, you can look for us at KC Pub Health. That's KCPUB Health. And lastly, if you want to keep track of what we are up to, what we worry about, what we want people to know about and educate themselves about, please look up the publichealthinsider.com. That is a blog that's maintained by our amazing communications team, and it comprises and compresses all the pertinent topics about public health and the health of our community in one reading material format for easy consumption. Thank you so much for your support. Thank you. Stay safe.
Faisal, thank you so much for stepping into the role with your passion and being ready to guide the staff at Public Health Seattle King County in the ways forward with so many different issues facing your entire team. Thank you so much for joining me today. It was really an absolute pleasure.
Thank you, Trae. It was a pleasure to be here.
Wow.